Hello, today I'll be covering treatment of classic scabies. There are three types of scabies. First one is classic scabies, where only topical treatment is usually sufficient. This is the most common type of scabies. Second one is crusted scabies, also known as Norwegian scabies. See, it is severe infestation with crusted lesions. Both oral and topical agents are used together. Third one is scabitic nodules, which may require intranodular steroid injection as it is an hypersensitivity reaction to the scabies mites. Options for topical treatment are permethrin 5%, which is most commonly used and it is the first line therapy. Other options are benzyl benzoate 25% lotion, crotamidon 10%, sulfur, malathion, linden 1%, and spinosad 0.9%. So now topical permethrin 5% we will be learning in detail. So how to use it. First, the cream should be thoroughly massaged into skin and washed off after 8 to 14 hours. It should be applied from the neck down in adults because scabies rarely infest the scalp of adults, but to the entire head and neck in infants and geriatric patients as hairline, neck, temples, and even forehead may be infested in them. One application is generally sufficient, but a second application is recommended after 1 week. Ensure application of cream under fingernails, toenails using toothbrush, soles of feet, and scalp for children. Topical permethrin 5% is a synthetic neurotoxic pyrethroid class of medicine. It targets eggs, lice, head lice. It is also used in head lice and mites. It works on sodium transport across neuronal membranes in arthropods, causing depolarization and respiratory paralysis. It is a valuable agent in treating scabies and pediculosis. It is very safe. Less than 2% of applied permethrin is absorbed through human skin. During the 72 hours after topical application, permethrin's inactive metabolites undergo nearly complete excretion into the urine. Permethrin's postulated lethal oral dose is 1 to 2 grams per kg of body weight in humans. Between permethrin and ivermectin, it is the similar efficacy and proportion of side effects. Pregnancy, it's category B, and breastfeeding also it is safe. So adverse effects are increased or new onset of pruritus, burning or stinging sensation. And there is a rare case report of patient presenting with muscle dystonia. Clinicians pursued supportive treatment because there is no antidote for permethrin toxicity. Contraindications are infants before the age of 2 months and known hypersensitivity to any of its components or any pyrethroid or pyrethrin. Now benzyl benzoate 25%. 24 hours after applying it, thoroughly wash the body with warm water and soap. It is low cost, recommended in resource limited countries. It is forbidden in pregnant and lactating women, infants, and young children less than 2 years of age. It is not available for medical use in the USA, and the side effect is skin irritation. Next is crotamidon 10% lotion or cream. It is applied on 2 consecutive nights. Second application is advisable 24 hours later and wash off 48 hours after the second application. It has antipruritic action also. The most common side effect is skin irritation, not safe in pregnancy. It is pregnancy category C. Now comes the sulfur, which is the oldest anti-scabitic in use. Topical sulfur is used as 6 to 33% cream, ointment or lotion and is administered as follows. 240 gram of 8% or 10% precipitated sulfur in petrolatum is used for adults. It is applied to body overnight for 3 consecutive days with bathing every day. It is messy, malodorous, stains clothing, and in a hot and humid climate may lead to irritant dermatitis. Sulfur should be used only in situations where adults cannot tolerate linden, permethrin, or ivermectin as it is inferior to all these agents. It is recommended for pregnant women, neonates, and infants. Malathion. 0.05% lotion is administered as follows. Single application applied overnight to skin and washed off 8 to 12 hours after that. Malathion is an organophosphate insecticide that irreversibly blocks the enzyme acetylcholine esterase. Malathion is not recommended nowadays for treatment of human ectoparasitic infestations because of the potential for severe adverse effects. It is not recommended in newborns or infants younger than 1 year. Pregnancy, it is safe category B. This medication contains an ingredient that could easily catch fire, so it is a flammable. So therefore, avoid smoking, being around open flames such as fireplaces, stoves, campfires, or electric heat sources such as heaters, hair dryers, and curlers or hair irons while using malathion. Spinosad liquid 0.9%. In 2021, spinosad, a drug previously used to treat head lice was approved by the US FDA as a topical scabies treatment. It is approved to treat scabies in patients 4 years of age and older. Other drugs target mainly the passive nervous system, killing only the motile diseases. As they lack ovicidal activities, repeat treatments are required to achieve complete cure. This is the first single-dose scabicide. It shows excellent efficacy, little systemic absorption, and no serious adverse reactions. Spinosad acts on nicotinic acetylcholine receptors and GABA receptors in the arthropod, muscular, and nervous systems, leading to involuntary muscle contraction and paralysis, safe in pregnancy category B. So now comes Linden lotion 1%. Although FDA approved to treat scabies, this medication is generally only used when other scabies treatment fails. It was formerly known as gamma benzene hexachloride. It is available as both cream and lotion and shampoo. So cream and lotion is used for scabies infestation and shampoo for lice infestations. It should only be used once and then should not be used again. Besides skin irritation, it can cause serious side effects like seizures. Pregnancy, it is category C, not safe for infants and small children less than 3 years of age. So now comes the oral treatment ivermectin. Oral ivermectin is used in the dose of 200 microgram per kg single treatment given orally, repeated after 1 to 2 weeks. It is not recommended for pregnant or lactating patients or children who weigh less than 15 kg or who are less than 10 years of age. It is low cost, easy administration, high compliance, well tolerated, good for mass treatment in facilities, but it is not yet approved by US FDA for scabies treatment. So other things which we need to give to patients are antihistamine and pramoxynlation to control the itch, antibiotic to wipe out secondary infection, steroid cream to ease the redness, swelling and itch. Management of scabies not only includes prescribing the drugs but also educating patients properly about the method of application of the drug and other things regarding their clothing and all which they have to follow. If we don't follow these measures, the patient is going to relapse. Now we'll come to the other things which we need to consider. So rash and pruritus may persist for up to 4 weeks after treatment and patient must be advised about this. The patient should be advised to trim fingernails and toenails. Treatment of fellow household members, close contacts and sexual contacts is very necessary and all of them should be treated at the same time to prevent reinfestation as infested individuals may be asymptomatic for up to 6 weeks but are able to transmit infestation. Patients with typical scabies may return to school or work 24 hours after the first treatment. Bedding, clothing and towels used by infested persons or their close contacts anytime during the last 3 days should be decontaminated by washing in hot water and drying in a hot dryer, by dry cleaning or by sealing in a plastic bag for at least 72 hours. Scabies mites generally do not survive more than 2 to 3 days away from the human skin. Symptomatic individuals in an institutional setting indicate an infestation lasting several months. Surveillance among institutionalized persons and staff as well as control, that is hand washing, avoidance of skin-to-skin contact with cases should be put in place. So now we will summarize. So all adults and children except pregnant and lactating women and children less than 2 years, the treatment should be permethrin 5%. If not responding, then we can go to ivermectin and the other options are clotamidone or spinosad or other available treatment. And the drugs which are safe in pregnancy are permethrin 5%, sulfur, malathion and spinosad, but not benzyl benzoate, clotamidone, linden or ivermectin. And drugs safe in neonates and infants, permethrin in infants more than 2 months of age and sulfur, but not benzyl benzoate, malathion, spinosad, linden or ivermectin. Thank you.